Hello, I'm Dr. Nicole Iovine, and I'm the hospital epidemiologist in chief. Today, I'd like to talk to you about the right way to put a mask on and to take it off. But first, we have to review how to clean our hands. So there's two ways that you can perform hand hygiene. One is by soap and water, and the other is by using one of the alcohol-based hand sanitizer. If you're using soap and water, you need to first wet your hands, then use soap, and you need to wash all surfaces of your hands for about 20 seconds at least. And then you rinse thoroughly and you use clean paper towels to dry your hands. If you're using an alcohol-based hand sanitizer, you will use the product on your hands and rub it all over the surfaces of your hands, again for about 20 seconds until your hands are dried. At that point, after you've done this, then you're ready to put on your mask. So masks help prevent the spread of infection when the wearer coughs, sneezes, or even is speaking. Because these masks in general are rather loose-fitting, though, they don't completely protect the wearer from inhaling infectious particles. However, they will provide some level of a barrier protection if somebody were to cough or sneeze within 6 feet of the wearer. But this is the reason why keeping social distancing, meaning 6 feet apart or more, is so important to preventing the transmission of infection. When you're ready to put on your mask, the first thing you should do is remove your glasses if you wear glasses. Next, you should perform hand hygiene either by washing your hands or by using an alcohol-based hand sanitizer. If you're wearing an ear loop style mask, pick it up by the ear loops and hook it around your ears. Next, pinch the mask over the bridge of your nose to make as tight a seal as you can, and then extend the mask over your mouth and chin. Make sure that the mask covers your nose and your mouth. Next, you can put your glasses back on, and you should perform hand hygiene. If you find that your glasses are fogging up, this could mean that you don't have as good a seal over the bridge of your nose as you might need. So in that situation, you should perform hand hygiene again and try to affix the mask more tightly over the bridge of your nose. Then you can do hand hygiene again. When you're ready to take off your mask, the first thing you should do is again remove your glasses if you wear them. You should perform hand hygiene, as we've discussed. And then you should unhook the mask from behind your ears and pull the mask away from your face without touching the front of the mask. If the mask is soiled or damaged or very hard to breathe through, you should discard it at this point. However, if the mask still is intact, you can carefully fold it so that the outer surface is held inward and against itself to reduce contact with the outer surface, which is going to be the contaminated part. And then you can store the mask in a clean, sealable paper bag or other breathable container. If you're going to take the mask off in order to eat, you can remove the mask and place the outside of the mask on a clean napkin or tissue. You must remember also to perform hand hygiene after you've taken off your mask. So here's another safety tip about masks. When you're going to eat, you should disinfect the surface that you're going to be eating off of. Any commercial disinfecting solution will be fine for that. Get a clean tissue or napkin to place the mask on. You should perform hand hygiene and remove the mask as I described. While you're eating, it's important to maintain 6 feet of social distancing when your mask is not in place. So if you have the kind of mask that ties in the back of your head, you can follow these same steps for putting it on and taking it off. Wearing these masks are going to help to prevent the spread of COVID and other infections in our community. Thank you.